required in advance of that, we'll be letting you know as well. And with that, I wanted to introduce Dr. Henry.
Thank you very much, and thank you for being here this morning. So, as Minister Dix has indicated, we've committed to providing you with the numbers of tests and samples that we have tested in our lab here in British Columbia. And so, as of yesterday, the number of samples that have been tested is 114, and we have had, as you're aware, the one positive. We will continue to report these tests that we have done on a weekly basis, and they'll be posted on the BC CDC website every Friday morning at 9:30, so that you'll have an updated understanding of the number of people who have been assessed and tested for this coronavirus here in BC. Having said that, if we do have a positive, we will be notifying you immediately when that testing has been completed at the BC CDC lab. So just so that you're aware of that. The other thing, certainly on Tuesday, we wanted to, we had originally planned the media briefing to give you some updates about the actions that we were taking to prepare here in British Columbia. And as I'm sure you're well aware, the WHO yesterday declared this a public health emergency of international concern. That is something that is not unexpected, and we have been following very closely both the activities in China and the very concerning increase in numbers of countries that have had imported cases. And in particular, the WHO was concerned about importation of cases to countries like India and a few other low and middle income countries where the health systems may not be as strong as countries like Canada and Europe, for example. So part of the rationale for declaring the emergency is to be able to marshal resources from around the world to support all countries in being able to contain this virus. And that is one of the really key things around the public health emergency of international concern. So I've been asked a number of times, what does this mean for us here in BC? And the essential answer is nothing has changed. We have increased our health sector response and our preparedness. We've created our coordinated response level where we have our provincial coordinating committee that includes our health authorities, public health, our emergency medical services, HealthLink, so that we're all working together on common approaches, common messages, making sure that clinicians and the healthcare sector are up to date on what the issues are, what the risks are, and what measures we need to take to safely assess, test, and care for anybody who might have this virus here in British Columbia. So there is no change for us, both here in BC and also nationally, where we have established a special advisory committee, and you've heard the Public Health Agency of Canada talking about that. I am BC's representative on that committee, and we are meeting almost daily. We'll be meeting again later this morning to discuss how we make sure we have a coordinated approach across Canada. So we have done these measures in advance of the public health emergency being declared because we recognize how important it is right now in particular that we are able to assess people, be able to test them and care for them here if need be. And I mentioned this on Tuesday, but I think it is really important and bears repeating. We are at a critical phase right now, and the WHO has said that as well. We know that very strong measures have been taken, and some very restrictive measures have been taken around the affected areas in China in particular, and that has reduced the number of people who are traveling and the number of people who will be coming to BC, to Canada, and elsewhere in the world. And the WHO has been on site and has really commended the Chinese government on the actions they have taken. And that will help protect us as well as help protect other parts of China. Having said that, that happened, those measures were taken really about 10 days ago. And we are now at the point where people who have traveled here to BC and to Canada who are incubating this disease may start showing symptoms. some of the new data that's come out of China has shown that the incubation period is, as we expected, for the most part around a maximum of 10 days. And so we've been using 14 days as give ourselves a bit of a buffer zone. But most people start showing symptoms around day 3, 4, 5 at the latest. So the average incubation period is about 5 days. So right now we are being very vigilant in BC. Our clinicians, our medical health officers, our public health system are connecting with each other. If anybody has any concern about somebody who has traveled, who has been in contact with an ill person, who has been in the affected areas of China, we are having a very low threshold for testing, which is why we have quite a high number of samples that have been tested in our lab. And we will be continuing that, particularly for the next week or so. The one other thing I did want to address before I turn back to Minister Dix is I have also been getting a lot of questions about why. Why are we putting all of this effort into this virus when we have a lot of respiratory viruses, as I've mentioned before? This time of year, we have influenza every year that causes an increased number of deaths and illness in people across the province, and certainly in our healthcare sectors, in our long-term care homes. And the reason is because this is a new virus that has just jumped the species barrier into humans. And we had the same issue with SARS, and it does cause very severe illness in some people. Clearly, younger people are doing better, may not get as sick, may not have as many symptoms or side effects. But we have one opportunity as a global community to push this back. And this is our opportunity now. If we do not take all the measures that we can take right now to make sure that we eradicate this virus from human populations, then we may end up with yet another ongoing endemic infection like influenza that we will have to deal with every year that causes severe illness and some deaths in human populations. So it's not an either-or thing, that we're not paying enough attention to things like influenza. It's the opportunity as a global community right now to try and push this virus back and back into the animal population and eradicate it from human-to-human transmission. And that's a really important thing. We have been successful in doing that with SARS, and I'm very anxious about it, having lived through that experience, but all of the measures that are being taken now around the world to try and address this, and this speaks to why I believe the WHO did up their game, if you will, in terms of declaring this a public health emergency, because this is our chance to do just that and try and make a difference and with this specific virus. So I'm going to leave it at that, Minister Dix.
Thank you. And I wanted to thank Dr. Henry. I wanted to thank clinicians around British Columbia, people at the health authorities, people at BC Emergency Health Services, everyone who is part of our public response here. I was in the elevator at my home this morning, and there was a message from the Ministry of Health there about influenza and the things that we can do to stop its spread, washing hands, getting rid of tissue when we use it. And when we're sick, stay home from work. When we're sick, stay home from school. And I think this is, when people want to be empowered in these times, these are the things that we can do together to help one another. And the final thing I want to say is we are most effective as a society when we're generous and compassionate. When we understand as a society, I think, what we need to do together to help each other. When we're sick, we help each other get better. That's what makes us effective. It's not only a compassionate thing to do, it is an effective and efficient thing to do. And I'm very proud of the response of the BC healthcare system, both in the past to outbreaks and currently to our response to this. So as Dr. Henry has said, when cases are found, when there are presumed positives, we will let you know. Every week we will tell you how many people we've tested. Today that number is 114. There is one positive case. We'll continue to do that because we think that's important. And we'll continue to support our public health officials, our primary care providers in doing the work they do. And I'm very proud of that work. And with that, we'll open the floor to questions.
Okay, Okay, before we get started, we're going to do questions in the room first. Those of you on the phone will come to you in a few minutes. Please press *1 if you want to queue up a question. For those of you in the room, my colleague Elaine is coming around with a microphone. Please wait for the microphone to reach you before you begin asking the question. And if you can identify your name and outlet before we start. Let's start down there, actually.
Andrea Wu from the Globe and Mail. As a public health official, do you feel that evacuees from Wuhan or China more broadly should self-isolate or be quarantined upon their arrival back in Canada?
Yeah, that's a really important question. As we know, the government is negotiating to do just that with Canadians who may have issues in China. We are discussing this as an issue with my colleagues across the country. I believe that quarantining is a very extreme measure, and it is not, in my opinion, warranted. It's not what we're doing with others. We do, of course, want to make sure that we are monitoring people's health very carefully, particularly people who have been in those areas where we know there's circulation that it is at an intensity that's much more than what we have here. So we will be ensuring, and I'm speaking for my colleagues across the country and the Chief Public Health Officer, part of our job is ensuring that the people who come back are monitored, are safe, and are able to access and be cared for if need be, and that we do everything we can to ensure that there is no risk to the population in Canada.
That might be a
There's many things during the SARS outbreak, for example. Close contacts of cases were asked to self-isolate, and we supported them in being able to do that. We want to make sure that there's no opportunity for exchanging of viral particles with others as much as possible. So that is an option that I think is a reasonable approach for this.
Dr. Henry, do you have any advice specifically geared towards students and staff who are in these facilities where especially the younger demographic might not be as inclined to follow hygiene recommendations as much as the adult population? There are some parents who are expressing concern about their students, particularly in those schools where people have traveled to and from China.
Right, and I've been hearing a lot of this, both from friends who have young children, and I hear as well there's a lot of anxiety among young people that they don't know what's going on with this, and I'm going to be doing some work around questions and answers for young people, and we've been working on that. One of my colleagues here, Dr. Crabtree, and I have been working on some messages that we can help. But the other thing I do know, we have a program called Do Bugs Need Drugs? You may be familiar with it here, where we talk to children in grade 2 about the difference between a virus and a bacteria and the importance of things like washing your hands and staying healthy. So we do know that we can have these messages, and they're very effective for young people, young children. And not only is it effective for young children, but they bring those messages home to their parents. So it actually disseminates that. So yes, we're working with schools to have those, to talk to children, and particularly in the schools, about what are the things that we do to keep ourselves healthy every day, to make sure that hand washing is available in schools, and that there's a teaching of children how to do that effectively, and how to use alcohol-based hand rubs if need be. So those are things, covering your mouth when you cough, and the messages around how important it is, if you're not feeling well, if you're sick yourself, to stay home, stay away from others.
And if I could just ask a quick follow-up. This morning we learned that the first confirmed case in Canada, the patient in Toronto, was released from hospital as his wife remains in isolation at home. Is there any update on BC's confirmed case, the man in his 40s?
He is doing well. His condition is stable, and he's being actively monitored by health officials on a daily basis.
Yeah, Frank Xu with Omni News. The first question is, we here in Vancouver, especially YVR, has the most number of flights directly to China, even without Air Canada.
Mm-hmm.
And so we are a possible port of entry for the virus. So what kind of information you are having from the Chinese authorities or cooperation from them to have clear messages on the development of the situation there in order to better prepare here? The second question is, you mentioned that you recommend. Can you say that you recommend people traveling back from China, especially Wuhan or Hubei, to self-quarantine or self-isolate?
So I'll answer the first question. Yes, we have the Chief Public Health Officer of Canada is on the advisory committee to the emergency committee that met. The federal government, who has jurisdiction around the airports, is in contact with Chinese officials as well as with the WHO and our counterparts around the world. So yes, we are getting not only information about what is going on the ground, but the measures that the Chinese government is taking to prevent anybody who is a contact or a case or has any symptoms from traveling. So that is reassuring, and that has been stepped up quite dramatically in the past week. We continue to have a presence at all of the airports where there are direct flights, including YVR, and providing people with the information, having them assessed as they come across the border. So, it's not perfect. It's the best that we can do, and we do have evidence that people are getting that message. And, I said this on Tuesday, but when we have a crisis like this, people do the right thing for the most part, and people are aware of the things that they need to do. And so, to address your second question, we have been telling people to moderate their activities if they've come back from China, particularly in this period of time. I don't believe it's warranted to formally quarantine people, but we've asked people to be conscious of not going to mass gatherings and to be very conscious of their own symptoms if they have any, to isolate themselves and to stay home.
Hi, I have a question for each of you, actually. I'll start with Dr. Henry. Out of the 114 that have been tested, can you tell us how many of them were picked out at YVR because showing symptoms, fever, etc., and how many of them, like this positive case, actually came forward on their own?
Yeah, so I can't tell you the exact numbers. I know there have been a handful of people who have been sent for assessment from YVR. I don't have the exact number on that. The only positive is the one person. Most of the people have been assessed in the healthcare system and have been connected with the medical health officers, so public health and our clinicians around the province, and they are from around the province, have been working very closely to make sure that anybody who has any concern is getting the appropriate testing.
So most have not come from YVR or CBSA?
Yes.
And Adrian, I'm not sure if this is a question for the provincial government, it's more federal, but we're hearing that some BC permanent residents in Wuhan right now can't get out. They're not allowed on that plane because they're not Canadian citizens, and it's frustrating for their loved ones here. Is there any role BC can play to try to get permanent residents of BC and Wuhan a evacuation flight out?
Well, we've been working obviously with the federal government on these issues. That's an issue they're working on, and the question really is appropriately given to them. We don't want to provide anybody with incorrect information. Obviously, we're in close contact. I met by phone with provincial and health ministers and the federal health minister yesterday, and we discussed generally these issues. They're working on them. There are a number, as you know, because it's been reported with other countries and with Canada, of complexities in getting people out. The Chinese government is obviously very clear that anyone who is diagnosed will not be allowed out, and that's their clear position, and that's a public health response. But it's up to the government of Canada to address those issues, and any support we can be, we'll be working with the federal government closely, because obviously some of those questions affect us directly. But we're trying to work, and I think we're succeeding in working with our fellow ministers as one team on this issue. I think it's fair to say Dr. Tam and Dr. Henry are in regular contact as well. Very regular contact, I'd say, and so we're working closely on these issues, and we're supporting each other in every possible way.
Sheila Scott from CTV. I just want to break down that 114 number a bit more. Just to confirm, those are tests that have not come back with any results yet, is that right?
No, those are the tests that have been completed. So 113 are negative, 1 is positive.
For anyone that's undergoing testing now, is there anyone in hospital or under self-quarantine at the moment?
there's a number of people being assessed every day, and that number varies, and that's why we're giving you the sense of the scope of what we're dealing with by giving you the number of tests that have been completed as of yesterday, and the people who will be tested today and tomorrow and Sunday, we'll give you those numbers next Friday.
What's the turnaround time on the testing?
The turnaround time at the BC laboratory is 24 hours.
Are you getting people just coming to hospitals saying, I think I have coronavirus? Sorry, I'm sorry to jump in here. The mic was going fast.
Absolutely. People are, particularly since we announced that we had our first case here, there was a heightened level of concern for the next 24 hours. People were calling 811, where the health line, where you can talk to a nurse about your concerns, and much of it was people who were worried, who had no contact history, no travel history. We do have some people who heard the messages and have called ahead to their healthcare provider or called ahead to the Emerge, have been assessed and tested. So it's been run the gamut, and I'm actually really pleased. The public health system, we tend to be in the background, and this is where it's really important that we connect regularly with clinicians, and clinicians have been talking to their medical health officers, and as I say, we have a very low threshold for testing anybody who's had a travel history or a contact history that's the least bit worrisome. So I'm confident that we are detecting way more people than are actually truly at risk.
Laura Kane, Canadian Press. Can you tell us anything more about the condition of the one man with the confirmed virus in BC? Has he improved at all since Tuesday?
His condition, it was never a severe illness, and he's doing very well. He still has some symptoms, but he's been closely monitored by the health services on a daily basis, multiple times a day, and we expect that he will recover.
And can you tell us anything more about his symptoms or his treatment? Is he quarantined from his family even?
We're not quarantining people, so he is self-isolated. He has a small number of close contacts who are also taking precautions when they're around him, so things like wearing masks, cleaning their hands, making sure they're not sharing airspace while he has symptoms, because that's how we know it can be transmitted. So there's a variety of measures that we put in place to assist people to make sure that they're not able to transmit to others. Yeah.
Hi, Mandy from Fairchild Radio. There's a confirmed case in Germany that the man infected by colleague who appeared not to have symptoms when virus was transmitted. So many people, especially parents, are worried about if the virus will be spread if symptoms not apparent.
Yes, and this is something that we're paying a lot of attention to, as is the WHO. And right now, the asymptomatic transmission is a challenge. It is certainly not what is common and not what is driving this outbreak. And I'm very familiar with the German issue. There was a person, and it's unclear whether she was completely asymptomatic or had some early symptoms. And it is clear that they had some close contact over a number of days. So this is a respiratory droplet spread infection, which means that you have to have enough virus in your body that it gets into your saliva, your mucous membranes, your excretions, and then you have to be able to get them into the air. Somebody else has to either pick them up and rub their face or breathe them in for this to be transmitted. We know as well for coronaviruses, unlike things like influenza, coronaviruses, the receptors that can allow the virus to get into your body are deep in your lung. So you have to have enough of them to get in deep in your lung. So if there is some transmission from younger people in particular, and that's one of the things we're figuring out from the data from China, is that younger people tend not to get as severely ill, and children in particular, they have not had, in the first 400 some cases, there were no young people under the age of 15 who were infected. But we have detected that some of them may have had a very mild illness. So whether someone can transmit with a very mild illness, that's probably likely, and the younger people who are having short duration of illness, which is all to say, it may happen, and it's certainly theoretically plausible, but it would not be a very efficient way of doing it. And the basic measures that we take to try and clean our hands, to cover our mouth when we cough, and certainly if we're feeling ill, to take those measures and to stay away from others is really important.
Hi, Martin McMahon with News 1130. We've heard that the National Lab is developing or has developed some sort of a rapid test for detecting coronavirus. Is that test available here in BC, or have you had any communication with the National Lab about getting access to that test?
Yes, and the short answer is all of our laboratories, the public health laboratories across the country, are working together. There are only a small number of laboratories in provinces that are able to develop their own tests, and ours is one of them, thankfully. So the test that we have is a very rapid test as well. And Dr. Mel Krajden, who's the lead of the public health laboratory here, has been working with the NML to make sure that we have the complementary and the best tests possible.
And in terms of these 114 tests, is there any logistical challenge with that in terms of overload for labs, or is that manageable? I have no context on that workload.
Well, I will say that our public health lab is stretched and has been for a number of years, and there's a whole variety of reasons for that. But this is where we excel. We have some incredibly talented clinicians in our lab here. We have a biosafety level 3 laboratory, which means that we can work on new bugs as they arise, and so the tests that were developed here using the same type of genetic testing that the National Microbiology Lab was doing, we were in the forefront of being able to develop it here and to continue to develop it. The lab is working 24 hours a day, 7 days a week to make sure that we can process these samples as fast as possible. So yes, it is taking its toll, but they are coping and we're supporting them in doing that.
Okay, we have one more question in the room, and then we're going to go to the phones.
Just one question for you, Minister Dix. Hi, I'm here.
Bonjour.
Could you please resume the situation in French, and also have you been in contact at all with people from BC that are stuck in China?
Personnellement, à la deuxième question, non. Pas directement, mais on en a parlé, bien sûr, et on est en contact direct avec le gouvernement fédéral qui dirige ce dossier-là. Cela étant, et ce qu'on annonce aujourd'hui, c'est qu'on a fait 114 examens ici en Colombie-Britannique au BC Center for Disease Control. Il y a un examen qui était positif, on a annoncé cela plus tôt dans la semaine, et 113 qui sont négatives, et ça c'est important. Chaque vendredi, on va annoncer ce chiffre pour démontrer au public nos actions. Chaque mardi, le Dr. Henry va faire une présentation devant vous pour illustrer ce qui se passe en Colombie-Britannique, pour répondre aux questions. Et donc, on est à chaque moment, nous sommes bien entendu préoccupés avec la présentation au grand public, les renseignements qu'on a. Et je suis très fier des actions du BC Center for Disease Control, de Dr. Henry, de tout le monde dans le système, qui travaille dans le système, parce que c'est très important. Notre bilan est excellent en Colombie-Britannique dans la réponse à une telle situation, y compris notre réponse à SARS il y a une quinzaine d'années. Et je pense, je suis très fier de la réponse jusqu'à maintenant. Mais cela étant, c'est une situation préoccupante. On travaille chaque jour, 7 jours sur 7, pour répondre aussi vite que possible aux examens, et c'est ce qu'on est en train de faire actuellement.
Okay, can we get the first question on the phone, please?
Yeah, our first question is going to be from Bob Mackin. Please go ahead, Bob. Hello? Hello? Yes, please go ahead.
Hi, Bob.
Hi. We still seen the misinformation that you've been worried about manifest itself in panic buying of masks. We've even seen photographs of people wearing plastic jugs in their head at Vancouver International Airport. There's even a statement on the Chinese embassy website that recommends calling, in addition to 811, it even recommends calling 911. And I looked at the BC government's own communication resources. You're running a TV campaign right now on daycare. There's nothing on the government's YouTube page about coronavirus. There's nothing on the BC government homepage or even the Ministry of Health homepage on coronavirus. There's nothing on the government's Facebook page on coronavirus. There is a photo of Fraser Valley berries on cheesecake, but there's nothing on coronavirus. So I'm wondering, why isn't the BC government doing more from a communication standpoint in both English and Chinese to stop the fear, stop the misinformation, and deliver people good information that can give them peace of mind?
The short answer is that we are, through the BC Centre for Disease Control. I think Dr. Henry has been very active in responding both to media interviews and to respond in putting out public information. I strongly recommend what the BC Centre for Disease Control did yesterday, which I retweeted and put forward and advanced, which is a response as to the details, sort of the medical details of the virus and how to respond and answer to questions. We're going to continue to put out more information on all of these issues and respond to misinformation where we can. Obviously, on social media, we can't respond to every piece of misinformation. And what I want to encourage people to do is to get information from reliable sources. And in British Columbia, the most reliable source of that information is the BC Centre for Disease Control and the provincial health officer. And we're going to continue to be putting out more information. It's why every Friday we're going to be saying how many tests have been conducted and those numbers, and we're going to provide that information on a regular basis. Why every Tuesday Dr. Henry will be meeting with you as long as is necessary to provide information. It's why we've added interventions and responses to people, and we're going to continue to do that. So I'm very proud of the work that's been done by clinicians, very proud of the work that's been done by health authorities, by all of the people involved in our coordinating committee, and we're going to continue to be providing more information as is necessary. And as well in the public health domain to continue to provide information and knowledge about other issues. Because if you've got underlying conditions, the reason why we're testing people is is that they're sick. And so all of the information that's relevant for public activity with respect to the novel coronavirus is also relevant for influenza and other conditions. So I'm proud of what we're doing. I appreciate that you may think we can do more, and you can bet that we're going to continue to do more in the weeks to come because this is an issue of public concern.
The biggest TV broadcast of the week will be the Super Bowl. Will the BC feed of the Super Bowl broadcast include any BC government advertising? And will that BC government advertising be themed on coronavirus, again, to give people peace of mind and the good information people need to make the good decisions?
Well, I don't think we need the Super Bowl to provide good information. Obviously, that's a big media event, but I think people can find that information today at the BC Centre for Disease Control, that we'll be putting out excellent information. And the idea is not to make a splash, but to every day to provide the information people need. And that's what we're doing. That's what we're doing in this matter. And I think the buying of Super Bowl ads, I have no idea if they're government or who's buying Super Bowl ads. I think that's a subject of general interest. But our job today and every day is to provide excellent public health information, and that's what we are going to continue to do.
But with all due respect, I give you a long list. There's nothing on the government YouTube page, nothing on the government Facebook page.
Can I make a comment about
homepage.
some of the things that I think are important about some of what you said in terms of public gatherings, and the Super Bowl is one. I tend to be more of a Grey Cup fan myself, but those who are going to Super Bowl parties are going to be together. And you know, these are times for celebrations with the Lunar New Year, with other things that have been happening. And the most important thing that I want to say is we should not be canceling these things right now. That is not where the risk is in this community. But if you are somebody who's sick, don't go. that is your personal responsibility to protect the others that are around you. And if you have concerns about travel and concerns about your health history, to call 811, call your healthcare provider, and so get advice so that you can be safely assessed, tested if need be, and cared for.
We're going to go to our final question on the phones now.
Our next question is going to be from Daphne Brian. Please go ahead, Daphne.
Yes, Canada has issued a travel advisory for China that you're only essential travel. But I'm wondering, we have so many flights going from YVR that are actually connecting flights. So are you recommending, or do you have any advice for people who might be flying through China and what they should do to take any precautions during their transiting through those airports?
And certainly this is much more of a national issue, but my advice to people is to seriously consider, if you are going to China, postponing or looking at whether you need to go right now. Health Canada has advised non-essential travel to parts of China should be avoided, and so has the U.S. and many other countries. And I think given the situation in China, not so much that I'm worried about this virus, but I'm worried about access to health services and other things in many areas of the country where a full-on effort is being put right now to try and contain and deal with this major outbreak that is causing a lot of illness and suffering in China right now. So travel to other parts of the world, I have no concerns about.
But just to be clear, if people who might be flying through an airport like Guangzhou, which is a big center, would you recommend that they not even do like a 2-hour transiting then?
There's no concerns that I'm aware of in transiting airports in China.
Thank you.
Thank you very much, everybody that's brought me up.
Thank you. You're right on. Thank you very much.